Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about one of my favorite exercises to give for hip, back, knee pain. But before I continue, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So today I'd like to show you some bridging exercises. And I really like this exercise because what it does is, number one, I find it a great exercise to help with certain weight bearing or functional exercises, just as a precursor essentially. So if somebody perhaps has had some kind of surgery in through the hip and through the knee area, and we're moving towards more functional exercises like a sit to stand, getting out of a chair, I find it's a great exercise to help to put a little bit of weight through the joint and really activate some of those muscles that are required to do a squat or a sit to stand type of movement. The other thing that's great about it is there's all sorts of variations that you can do to isolate different muscles, right? So for example, if somebody has maybe a weakness in their hamstring, or they really need to build up their hamstring strength, such as a post ACL surgery, it's a great exercise to help to isolate certain areas. And then you can also incorporate different bands in through the exercise in order to perhaps isolate the glute med muscle or pelvic stability. So it's a fantastic exercise overall in terms of pelvic strength and in terms of trying to build up your strength in both the hip as well as the knee area. So I'm going to demonstrate a few different ways to do the bridge. So I'm just going to lie on my back here. Okay. And then the first thing you want to do is you're going to bend your knees like so. And then all you're doing is you're just simply lifting up your pelvis towards the ceiling. So this would be considered your standard bridge. Okay. And then from there, if we want to make little alterations to make it more challenging, well, you can go into a single leg bridge, right? So now, again, I'm just isolating that one side. And then you can do the other. And then another great way to really try to isolate the glutes more is you can use a band, and this is just a loop, and place it around the leg. So now I'm engaging my glute med muscle. It's forcing me essentially to activate those glute muscles, and then I'm going to lift up again. So again, there's all sorts of different variations of the bridge. You can use uneven surfaces to do these on as well, which will engage those core muscles more. So again, all sorts of different ways and options in terms of really trying to utilize that exercise. If you have any specific questions or concerns, please leave a comment below. And please check with a physiotherapist to make sure that this exercise is appropriate for you. Have a great day, and thanks again for watching. Take care.